Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're talking about annual lab tests for everyone, and it is that time of year when people are reaching their deductibles. Very important to get in before the end of the year on your annual lab test. And Dr. Prather, what do you mean when you say annual lab tests for everyone?
You know, there's certain diagnostic tests that different people should be taking. You know, when you reach a certain age, you should be getting EKGs, you should be getting certain types of cancer tests, colon tests, all those types of things. But what does everyone need at least on an annual basis? And I'm talking about from a baby to 105.
Mm-hmm.
You know,
what about 106?
Well, 106 would be fine too. Of course, after 105, I don't think you need annual. No. But you know, it's what is it that everyone needs? What is actually expected, and what is the best thing for you on an annual basis? So we have 3 tests that we talk about. You know, our blood test with the urinalysis is something whenever you come in for your annual exam that you should have a nice thorough one. Mm-hmm. That's recommended by every single healthcare provider, insurance, hospitals, all the doctor groups all recommend that. But I'd also throw in there a hair analysis, mm-hmm. and I would also throw in a GI stool kit. Mm-hmm. You know, as things that everyone should be having on an annual basis, just to get the basics of how your health is going and give a synopsis of what's happening and what should be done.
So those 3 tests that you recommend at the Prather Practice is the blood work, and we're going to go through each of these specifically.
Certainly.
But the thorough blood work, hair analysis, mm-hmm. checking for trace minerals, and the GI stool kit.
Stool kit, correct.
Wonderful. Well, let's go into details about that and why they're highly recommended. And I know you use the best labs in the country for each of these. You've been in practice for 30 years, really looking at the best labs for these. What I like, too, is they're inexpensive. They're inexpensive to the patient, and yet can tell them so much about their health, these 3 tests.
Sure.
So let's start with the blood test. It's called the Prather Profile.
Right.
And how did they get that name?
The labs named it that.
The labs named it?
Yeah, they were coming in, and I was setting up my labs when I first started out, and I gave them a list of what I was wanting to do. And they were looking at it and said, wow, this is a really good lab test. You know, nice and thorough, a good profile. And, you know, they said, well, could we offer that to other doctors? And I said, oh, certainly. Mm-hmm. That wouldn't be a problem for me. I would have really appreciated it. So we get back the orders for the lab test, and they had named it the Prather Profile. And anyway,
it's been named that ever since.
It's been named. It's nationally offered. It's offered by every single major lab corporation in the United States. As a matter of fact, I was talking to a doctor out in California. I was talking to him about a patient over the phone. And he says, sir, and he says, now, are you the Prather of the Prather Profile? And I said, yeah, that's me. He said, oh, I love that test. And the reason that it's so nice is because it doesn't overdo it, mm-hmm. you know, where you're doing way too many tests. But you basically can tell if there's anything wrong with someone. In other words, if you have something wrong, it will show up in the Prather Profile. Mm. Now, I will need to probably do further testing, lab tests, to find out and dig a little deeper. But it gives an indication.
If something shows up.
Yeah, it's a little snippet in there of all the different types of areas, so you can come in, and it would be what you would call an executive profile. I have so many patients who come in, and, you know, I said, well, you know, we need to do some blood work. And they go, oh, I've had really thorough blood tests. You know, my doctor always does thorough. And I get them, and I'm like, no. Mm-hmm. You know, this isn't really covering every possibility of what could be going on, so I need to do further blood tests just to kind of cover everything. And oftentimes, it was something that was missed. You know, there's there's a feeling in there of not ordering too many lab tests, but it really winds up saving the insurance company if you can figure out what's going on. Mm-hmm. So, I've had people who came in and I went to the hospital and they had $20,000 worth of tests that they did on me. Mm-hmm. And I look at their blood test and it was just a comprehensive metabolic panel, and I'm like, okay, that's not thorough. Let's do the blood test, which is pretty cheap first. Less expensive. And when I do the full panel on that, I go, here it is. Here's your problem. And they go, you mean that was it? That was all they needed to do, and I didn't have to pay all that money because they still had their deductible and everything. I said, yeah, sorry. Mm-hmm. But you start out with a good thorough blood test because that's the most thorough, comprehensive, least invasive way of really finding out what's going on. So
yeah, and can you imagine the money the healthcare system could save?
Yes.
But let's talk about your education. That you have a diploma in internal diagnostics.
Yes.
Explain that too, and how that differs your education than most doctors.
Well, we even look at the blood test differently. Mm-hmm. I get in medical doctors and nurse practitioners, and I need to retrain them. It's easier to take people who are lay people and train them on my blood work because I don't have to unlearn them. Mm-hmm. So it definitely takes me longer to teach an MD and a nurse practitioner how to read the blood work than a layperson, because they've been already told on looking at it from a disease care standpoint. So, when I get a nurse practitioner, she comes to me with this blood work and says, this is what the patient has, but I don't see anything really wrong with the blood test. And I point out to them where the deficiencies are. And then they go, oh, okay. Mm-hmm. Because what they look at is the reference ranges. And the reference ranges has nothing to do with what is the optimal blood test. So there are optimal blood panels that should be done. TSH should be 2.5. Thyroxine should be 8.0 to 8.5. All those different types of lab values should be at very particular points for optimal reading, and that's what we look at.
And the reference ranges aren't the optimal.
No, the reference ranges are what 50% of the population has.
Well, I want to be better than the 50% of the population.
And a lot of the 50% are sick. So, the optimal ranges may not be even in the reference range.
Why did they do reference range? To help the doctor? Or? Well,
the reference range is just a ballpark of where things should be. The federal government, had told them that they can't put down optimal ranges. I'm not quite sure why. But they don't want the labs to determine what that is. The doctors should. But the doctors aren't really trained in optimal. Mm-hmm. That's not part of their training. When you go through medical school, you get 15 hours of reading blood test. I have over 600 hours of reading blood test.
Big difference.
To understand how that all goes together. So it's a different type of a pattern along those lines, a different way of thinking about it, and there are many times where I get a patient in and their doctor has already read their blood tests. They bring in their old blood tests, said there's nothing wrong with you. What they mean is that there's no pharmaceutical or surgery that we need to do. That's what that means. In other words, there's nothing that I can really do for you according to this. Whereas I look at that, and if they have low adrenals, that's not something that the medical profession will treat. Mm-hmm. So, but we do, because we're dealing with structure function, we're looking at balance. We have things, we don't use poisons and toxins, which are pharmaceutically based. What we do is we use natural products to enhance and balance out the system and bring the body into optimal performance. which is a huge difference from how they treat medically. Disease care.
Makes complete sense. When we come back, more on annual lab test for everyone. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Why did you incorporate massage into your practice?
I believe that massage is an extremely important part of one's wellness, health regimen. It's something that everyone should have done at least once a month, if not more often, just to maintain a good, healthy type of a program in their system. As you work with the muscles and the soft tissue, you can actually create a tremendous amount of changes that occur. There are hormonal changes, there are physiological changes on balance. It's a very important part of one's health and wellness.
Yeah, it's much more than
And
just
it feels
feeling
good.
good. Well, it feels good, yeah. It's a lot more. What types of massage services do you do at your office?
Well, interestingly enough, there are a lot of different ways that massage actually can be involved in someone's health, and people don't realize how many types of massage there actually are. There's lymphatic, there's muscle, there's deep muscle, there's reflexology, there's electromagnetic, there's neurological, there's ones that can actually wake you up, some that can relax you, some that can balance out your emotional states. So there's a tremendous amount of different types of massage that can be affected on your system.
And who would benefit from massage?
Everyone. But if you have tight muscles, and I'm sure most people out there don't, a higher than average stress level, then massage can really prolong your life, reduce your blood pressure, increase your chances of preventing cardiovascular and cancer, especially if you're in a high stress position. Definitely take the time out for massage.
Here we have member pricing for our spa services for once a month massage at $59 a month.
Wow.
Which is great.
That is good.
Our massage therapist, we have from 11 years experience to 25 years experience with our massage therapist. So,
Yeah.
and there's nowhere else in town that you can get that kind of quality, massage for that price.
It is a medical level massage at that's a very good price.
$59.
Yeah, we also have a medical doctor on staff, nurse practitioner, chiropractic, acupuncture. We have all the diagnostics here so that, you can feel very assured that you have the support, of a whole healthcare professional team that is behind the massage therapist too.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. The end of the year is a busy and hectic time for all of us as we get swept up in holiday schedules. But it also might be the perfect time to take advantage of your health insurance benefits before deductibles and flexible spending accounts expire at the end of the year. If you're close to or have already met your insurance deductible, you have every incentive to take full advantage of all health care needs before the deductible resets. And for those with flexible spending accounts, you'll forfeit any unused funds at the end of the year. Now is the time to consider the benefits of your health insurance plan and schedule that annual wellness check. At the Prather Practice, we encourage everyone to have a thorough annual physical and the appropriate lab test that will map out the blueprint to your health. Don't miss out on the full benefits of your health insurance plan. Schedule your appointment at the Prather Practice before the end of the year. 317-848-8048. That's 317-848-8048. The Prather Practice, restoring hope.
Good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good. So
You're
good.
listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest.
Sugar and spice.
Today we're talking about annual lab tests for everyone. And Dr. Prather, we're talking about 3 tests that you recommend at the Prather practice for everyone. And they're very affordable. 2 of the 3 are covered by insurance, most people's insurance. First one we're talking about is the Prather Profile. That's our extensive blood work. So let's talk about what can be measured with the Prather Profile, these blood tests.
Well, it's nice because the Prather Profile covers everything. You've got the endocrine system, you've got liver function, kidney function, mineral balance. It just goes at the immune system. So everything that could go wrong with you shows up in our blood test. So having that done, I have a lot of people who come in and say, I just want the Prather Profile just to see what's happening, just for diagnostic, keep up on everything, not really looking for any care, but just to make sure that they're doing well. I even have MDs coming in and having it done, and then have me review it with them. Just because it's a different way of approaching it, and it really, if you're really looking to find out what is my optimal health, where am I really in my health overall picture, that's just a great way. In other words, it's just like I was talking to one patient, and she thought that she had different types of things going on. She had people who read her eyes iridology. She had people muscle test her. She had a lot of different ways that people were looking at it, to find out what was going on, and she had several different ideas of what they were saying. And I said, well, let's not, yes, let's find out.
Let's take your lifeblood.
let's do the blood work, hair analysis, and stool kit. And it was just such a relief to her, because then she knew what was going on. We don't guess, we know. So when I tell a patient that they have something going on, we know what the problem is. And it's very reassuring to know what the issue is. And then we can remeasure it to find out how the progress is going.
And I like how very individualized, and we review the blood work with them extensively. We give them a copy as we're reviewing it with them.
Have things marked down so that the patient knows. And then the patient starts to really get into it. And I've had patients who, moved away, and they called up, and, they tell their doctor that they want to get blood tests, and then they call me and say, well, guess what my sodium level is at this time, So, they're trained. So they're looking at it, which is very reassuring to know that you can even look at your lab tests. So they all want their lab tests when they've moved away, because they're reading it. They're in the medical. I think I'm annoying a lot of doctors from that, but they're reading their blood work as they're going along, which is very reassuring. That you have a patient who has more control, more ownership in their care, becomes a healthier person, a better, in my opinion, a better patient. And other doctors' opinions, it may not be a better patient, because they know when things are off and when things are right, because we train them what are the proper values.
Right, and you talked about the optimal values.
Optimal values, what they're going for.
So why is the Prather Profile so important? One of these 3 lab tests that you say everyone should have on an annual basis.
Well, it's when you've got your lifeblood, you can tell more from a blood test than anything else in the entire world. You can get more information from that from any other diagnostic test. And, they're relatively cheap, to get that. But, when they talk about blood, your lifeblood, that is very true. Your life is in your blood, and the best way to find out how your life is going, how your health is going, is through your blood. It's just a fantastic means, and when I found out all that you can find out, I wouldn't practice if I couldn't take blood. blood tests, you know?
And you don't personally take the blood.
Well, yeah.
You're kind of glad you don't.
Well, yeah, I think, yeah, I'm yeah, that's not, well, I mean, I don't mind it, but that's not something that I really have time to do.
But you are a little squeamish, the whole idea
when
of
I
your
have,
blood.
when I have my blood taken, I don't mind other people's blood taken. I can watch that all day. But I'm not really fond of, so, you know, for those that are like, oh, I faint when I have my blood taken, we lay you down. Yeah. We're really good at that.
A large office manager that can pick you up from the floor.
Yeah, we have excellent blood drawers.
Yes, we do.
Yeah, I'm really, and we do draw the blood right there in our office. And we have excellent people who draw blood. You hardly even feel it. But the children, they get their blood drawn at our office. You know, love the phlebotomists. Oh yeah,
yeah.
They're very, very good. And you know, we mentioned on it, but for those of you who are squeamish on getting their blood drawn, I'm one of them. I turn kind of white and maybe a little green. And you know, they lay me down to draw my blood, but I get it done regularly, so I can make sure that I'm keeping up on my health. Doctor has to stay healthy too, but I don't like to call it squeamish. It's the warrior's response. The warrior's response. They actually have named it that. Okay. Because what happens when you start losing blood, your blood pressure drops because then you don't bleed out. So. There's about 15% of the males, especially, have that, and they called it the warrior's response because they were being cut in battle and would start to bleed out, and their blood pressure would drop, and so that they could keep on fighting and not lose as much blood. So there's a definite change when I have my blood drawn. My blood pressure drops. Did you make that up? So it's the warrior's response. Yeah.
Laying flat to get your blood drawn doesn't sound much like
I like to think of it as a warrior's response.
You think whatever you want. All right. Let's talk about what's the difference between reading blood work functionally as opposed to disease care. You touched on this a little bit, but what is the difference?
There's a big difference. Disease care is that you're looking for major catastrophic type of changes that have taken place in the lab test. So, you know, even like taking cholesterol. Now, when I look at when cholesterol goes high, first thing I'm looking for is why. You know, there's a congested toxic liver, there's a lowered endocrine system, there's a lowered vitamin D levels. When a medical doctor looks at cholesterol that's gone high, it's time for some Lipitor. So I'm looking for causes, and they're looking for taking care of the symptoms. You know, what is it that we do to get this response? So when a C-reactive protein is real high, well, what am I going to do to lower it? Anti-inflammatory. What I do is I look at it and say, well, why has that occurred? So the thought process is completely different. And again, you know, one of the things that I'm doing on that is retaining my nurse practitioners and my medical doctors, because I sit there, I said, no, you're thinking disease care. We're not here for disease care. We're here for structure function care first. Now, we need to make sure that major types of things are taken care of pharmaceutically, which we usually refer out for. But in our office, what we're doing is we're dealing with balancing the body, bringing it back into homeostasis. Structure function care is all about balance. How do you balance out the body and bring it back into balance? And balance is called homeostasis. And the definition of health is homeostasis in the body. And so it's a different mindset, it's a different way of looking at the process, it's a different way of looking at the body and the patient. And it's hard to switch back and forth between the two. So it is definitely a training process along those lines.
And then how often do people have optimal blood work?
Very seldom. No one comes in with really decent blood tests.
Usually they'll come in to have you check it.
It's usually off. The only people who have blood tests that are working well, that are in optimal ranges, are people who've been seeing us for a while. Mm-hmm. Those are the people, and we get people in with perfect blood tests. And that's the ideal that we're going for. But people do not start out with optimal blood tests. That's just really rare to see somebody coming in. So really everybody is needing to get their homeostasis back under control.
Okay. Well, that's one of the 3 lab tests that you recommend for everyone at
Correct.
the Prather practice. That's covered by most insurances. So let's go on to the second one, hair analysis. Why is hair analysis important?
Well, you're looking, you've got the blood, but then we also want to look at the tissue. Mm-hmm. So the main thing that we're looking at with the tissue is the minerals and heavy metals to see what's going on with that. And the best place to look at that is in the easy way to cut off something is your hair or your nails. Not too many people want a piece of their flesh taken off and then analyzed. That would not be popular.
No. Here, let's take some flesh.
Yes. So the tissue, either the nail or the hairs on your head or anywhere on your body, is then taken, broken down, and then we can take a look and see what's going on with the mineral content in the tissue, and it can be different than in the blood. Mm-hmm. And so there's a tremendous amount that can be garnered from that. The calcium magnesium levels can really indicate what's going on with osteoporosis in the body and even be a predictor, and also tell us if we are starting to change that around. So anyone who's concerned about osteoporosis should have a hair analysis. That's one of the most important things that can be done. Also, the copper-zinc ratio is very important for the hormones balance. Mm-hmm. It also shows up quite a bit with the immune system. Manganese, either having too low of manganese can affect the pituitary and pineal gland, also cause problems with the pancreas. Insulin diabetes is very much involved with that. If you get too high of manganese, it can imitate Parkinson's. Mm-hmm. I've had people who came in who were diagnosed with Parkinson's, and really they had manganese toxicity. Lowered their manganese back down to normal, and all their symptoms went away.
Wow.
You can have too high of copper, and that can cause emotional and mental issues. You can have too high of mercury, which can cause a whole host of problems. You can have too high of arsenic, which causes neurological issues. So there are just a lot of different types of things that you need to get from hair tissue that you can't get from blood tests and other different types of tests. Mm-hmm. So the hair analysis is one of the things that I talk about that's absolutely essential for having a good understanding of what's your health and what's going on and how to balance you out in homeostasis.
And that's why we're talking about these 3 tests and why they're so important, and they encompass the whole health.
Right. You can't get stuff from, you have to have all 3 of them.
Okay. When we come back, more on annual lab tests for everyone. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
My family can eat too. They take that flimsy paper plate, pile it up like it was their last meal, go down the gravy bowl, squish a hole in the top, and cover the whole thing in gravy like a cholesterol volcano. And it always asks that same blessing. They, Lord, bless this food to the nourishment of our bodies. Now, I know the Lord works miracles, but you have got to meet him halfway. The Bible says your body is a temple, not a drive-through. Jesus fed the multitude with 5 loaves and 2 fishes, not 5 Krispy Kremes and 2 Bojangles biscuits. Can I get an amen? Amen. All right.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Doctor, doctor, give me the news. I got a bad case of loving you. No pill's gonna cure my head. I got
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, today we're talking about annual lab tests for everyone. And Dr. Prather, we talked about the 3 tests being the Prather Profile, extensive blood work, which is covered by insurance. We're talking about the hair analysis, which measures minerals and heavy metals. And then we're going to be talking about the GI stool kit. Let's go back to the hair analysis. What does the hair analysis measure again?
It measures minerals and the balance of the minerals, and then also heavy metal, toxic metals that could be going on. And you're talking about, the basic ones, lead, mercury, arsenic, all those different types of things. But even some of the regular minerals can become toxic if they become too high. Manganese would be a good example. Copper also. That can throw off the body and how it works. So you're looking at homeostasis, not too high, not too low.
Nice and balanced.
Nice and balanced.
So who should get a hair analysis?
Everyone, on an annual basis.
That is the title of this.
It is. It is.
And also, hair analysis are not covered by insurance. $125 for a hair analysis.
Sure.
That someone that had been diagnosed with Parkinson's, you talked about, it was, again, high manganese.
Manganese, right.
And then you balance that out and all their symptoms went away.
I've had quite a few patients with that type of issue. So, it just shows up how valuable it is. And it's amazing how it's so many different types of things that could be missing. I've had people who I convinced to do it that were having issues, and we weren't really getting to the root cause of it. And once we did the hair analysis, there we saw the issue, to get that fixed up.
Yeah. Well, let's go on to the third test, and that is the GI stool kit. This
Everybody's favorite.
Yeah, right. And this is covered by most insurances also. But what is measured with that, with the GI stool kit?
Well, in the GI stool kit, the important part of that is really what is your gut flora doing? The gut flora, there's been a tremendous amount of research that has been going on with the gut flora. The National Institute of Health has a very, very extensive analysis of how that affects the health of the body. And they even put out an announcement that it was far more extensive than what they had ever imagined. Matter of fact, they were saying that the research that they're doing will change healthcare in America, because almost all autoimmune diseases is coming from gut. They were even talking about the effects on cardiovascular disease, cancer, that really a tremendous amount of all those different types of things are really originating from the gut. You're talking about with the gut itself, if you took the average person's and flattened out the whole gut to, a single cell.
Small intestine, large intestine.
Small intestine, large intestine, and you laid it out, it would cover a football field.
Wow.
So, you've got all the
Inner.
little villi in through there, and everything's kind of stacked up. But that's how much surface area that you're talking about,
Wow.
which is a lot. And you don't think about that type of thing going on in your gut, but that's how much surface area is happening. You also have 80% of your immune system around the gut. Now, why is that? Because that's where 80% of your infections come through. 80% of the toxins come through your gut. Your gut is such an incredible key portion of your health that it's, we've been saying that for years and years and years. And the science and the medical aspect of that has finally caught up and proven what we've been saying since when I was taking the whole diplomat program. And even we have people who are writing about it in the alternative healthcare, quote unquote alternative healthcare, saying that the gut is the key to health back in the 1920s. And, that was kind of ridiculed by the established medical profession at that point. But it's absolutely true. So the gut is such a critical part, and I tell people that you need to really be thorough on what's going on in your health. You have to do one of the GI stool kits.
So what role does it play with the immune system? So you said 80% of our immune system's around the gut.
80% of the immune system around the gut, and then the gut itself has its own immune system going on. And the amount of stress on the gut, if you can take off the stress in the gut, the immune stress, or reduce it significantly, probably almost every single person would probably get over cancer. It would relieve most of the cardiovascular disease. You would probably stop any autoimmune process if you could relieve the stress off the gut. Infections. Most of the stresses of the immune system come through the gut, and if you reduce it, your immune system is strengthened. So the gut is just absolutely critical, and one of the things is that pharmaceuticals destroy the normal flora of the gut. All pharmaceuticals, not just antibiotics. Antibiotics are terrible. If you take
Terrible for that.
for the gut. I mean, there are times where you have to take an antibiotic, but it should be reduced quite significantly, because if you take a 10-day supply of antibiotics, it will, for a healthy person, it'll take 3 months for the gut flora to recover.
And that's a healthy person.
That's a healthy person. If you have it constantly on a constant type of basis, you're destroying the gut flora. If you have 6 antibiotics before the age of 6, your gut flora is shot.
Wow. So you're
it's
setting
toast.
yourself up.
All sorts of different types of diseases. We're talking about ADD, autism. We're talking about cardiovascular cancer, weakened immune system, autoimmune diseases. All of those things are really starting in the gut. And so having a good picture of that and how to get that corrected is absolutely essential to be able to get people healthy again.
So the GI effects, that's what they call it, the stool kit,
Right.
is showing up any infection in the gut.
It does show up, has a very strong indication of infection, parasites, how much stress is going on in the immune system, leaky gut, how the digestive enzymes are working, whether the fat balance in the gut is there. It tells me a tremendous amount of what's going on. Even gives me a very good indication of what's deficient in the diet. One of the things is that there's a balance between the gut flora on whether the body is getting enough fiber. Remember, I've talked many times about the balance between fiber and carbohydrates, simple sugars. And you need to have at least a balance in there, if not more fiber than the simple sugars. And people don't have that. I've not started out with any patient who was balanced on that. We have gotten patients balanced, but it's very few. Most of the time, there should be about a 50-50 split between the two. Most of the time, it's 98% to 2%.
Wow. And you can
On
see
the average
that
person.
on the
You can
stool
see that
kit.
on the stool kit, that you are taking in way too many simple sugars. You need to increase your fiber. And fiber is like one of the most healthy things that you can probably take in. If you want to, don't take a multivitamin, take fiber. You will get more benefit out of that than almost anything else. Fiber is probably the magic bullet for almost any disease in your system.
No pun intended.
Actually, it was.
Can leaky gut, you mentioned leaky gut, can
Sure.
that be measured?
It can. We can measure from the gut exactly whether there's a leaky gut, and that is something that the National Institute of Health confirmed. We've been talking about it for many decades. The idea of a leaky gut, and basically what that means is that large proteins are getting into the bloodstream that shouldn't be getting there and causing autoimmune reactions. So that can be measured, so we can tell whether someone has a leaky gut. If that is going on, then we have to fix that to be able to get the person well, because that puts on way too much stress on the body, causes too much inflammation, and the person will not be healthy until we can get that balanced out.
And when you talk about inflammation, it's a lot of inflammation coming from the gut.
80% of all inflammation is coming from the gut.
So what role does gut play in weight loss?
That is if you have the good balance but in the gut flora, it will almost automatically get you back into normal weight. So if you have a 50-50 split on your fiber and carbohydrates on the gut flora, then you are probably going to be at your normal weight. So what they found for weight loss is that the easiest, almost always effective means of doing that is increasing fiber. It's just one of the best weight loss processes in the body.
Right. And we're talking today about annual lab tests for everyone. And people are reaching their deductible this time of year. Time to come in and get those annual lab tests.
If you haven't had it done, have it done.
Right. Well, up next, we'll talk with a patient of the Prather practice whose lab test revealed a surprising reason for why he wasn't feeling well. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. How is TMJ treated at your office?
One of the most important ones is actually some jaw adjusting. The technique that I actually use, I invented. It needs to be extremely light adjustment. If you come in hard on the jaw, it's a very mobile type of a joint. So the angle, the pattern, and just the amount of right pressure, it's a very gentle type of thing. As a matter of fact, people just sit there and say it's sort of like a puff of air. Did you actually do anything except, all of a sudden all their pain's gone.
Yeah.
Matter of fact, the TMJ is one of the major causes of headaches. There's a different pattern if it's cervicogenic and jaw on the headaches. By the time we do the consultation, I usually know where the headache's coming from. It also has a very strong emotional effect. There's actually a direct nerve that goes right to the brain from the jaw that goes directly to the emotional center in the brain. The emotions can affect the jaw, and then the jaw can affect the emotions. Jaw problems of any type of musculoskeletal pain, people commit more suicide from TMJ. About 80% of everyone's going to have TMJ sometime in their life. And many times people aren't even aware that that's where their problem's coming from. One of the things that you have to do is the neck has to be fixed to be able to fix the TMJ. If you don't get the top bone called the atlas fixed, you'll never be able to fix the TMJs.
And that's something you do.
That's,
your specialty
we actually
is
have
the
a
atlas.
specialty on
Yeah.
that. So, but you can have TMJ problems and not have a neck problem too.
Okay.
But if the atlas is out, you're going to absolutely get nowhere with a TMJ. There's also a global type of a shift that occurs. The pelvis will actually shift. We've had people with elbow problems. We've had people with shoulder problems. And I said, it's coming from your jaw. And they're like, well, it doesn't hurt up
How
in
does
my
that
jaw.
happen? Yeah.
And so I go up there and adjust their jaw, and I recheck their shoulder and the elbow, and I said, does that hurt anymore? And they go, no. Oh my gosh. I've had people working on this for 2 years and never gotten this far, and you do it in just like 5 seconds. Examination and diagnostics are absolutely so essential for really understanding a problem. If you don't know exactly what's going on, if you don't know what the cause is, then you can't fix it.
Right. And when you know, it makes the treatment easy.
Oh, yes.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. I have been here. That is a patient at the Prather Practice and would like to share his story and his health journey with our listeners. Welcome, Ben.
Hi.
We're glad to have you. You've been coming to the Prather Practice the last 2 years.
Yes.
Tell us what initially brought you into the Prather Practice.
I had a number of issues going on and just did not feel good. Mm-hmm. And my wife, who's in the medical profession, would listen to Dr. Prather's broadcast every Saturday morning. And so she said, I just want to take you up there and check some stuff. So we came up here, and long story short, I'd never thought to be tested for heavy metals. Mm-hmm. And so you guys did a test for the heavy metals that was sent off to the laboratory, and it came back that I had, beyond the top of the lab charts, lethal level arsenic poisoning. Mm. And I'd had a number of surgeries over the last few years, and a lot of them were horrific orthopedic injuries. And then I come to find out that one of the signs of serious or lethal arsenic poisoning is unexplained muscle and tendon tears. And I kept getting them, and I could not explain why, when they were repaired. And so Dr. Prather started me through a chelation program, which you have to do to be cured or rid, or the arsenic removed from your system. The way I understand it, after doing some research then, is that arsenic will stay with you until the end of time unless it's pulled from your body. Right. So,
and we did the oral chelation with you.
Right, it was a shot.
Right, the homeopathic
shot every day. I've taken for 2 years. And just recently, the levels were dropped below lethal, and they're almost gone now. So
that's wonderful news.
Yeah, it took a long time, but as Dr. Prather said it would, because it was so high that it was going to take a long time to go about it, doing it slowly, so that it wouldn't overwhelm my organs and my kidneys and liver. So
did that process, you've been coming to us for 2 years, was that a 2-year process?
Well, he wasn't sure how long it was going to take. He said from the start that he knew it would be over a year, but he wasn't sure just how long it would take, because he said he'd never seen anybody with a level that high. that was living.
And I'm sure the labs called us that day.
Yeah, they did, as a matter of fact, and like I say, it was off their charts, and so it.
And now you're saying your level is normal?
It's below the lethal level.
Wonderful.
So that would be a normal, or it's all but gone. I mean, obviously you want it gone. So it's all but gone.
What problems were you finding before you had the chelation that you attribute to maybe the arsenic poisoning?
A lot of those, I've had 29 total surgeries, and most of them have been just horrific orthopedic injuries. Complete.
Which didn't make sense. Why?
I could not explain it to the surgeons, and
I think the surgeon was
happening
too. Yeah.
And they were too. And it just, I was always careful in my working out and followed the rules, and yet I would keep getting these injuries, and I just couldn't explain why. And so it got to the point where 2 years ago, I wasn't feeling good. I'd had I think 3 surgeries the prior year, and shoulder surgery. One of my knees had to be replaced because I tore it up pretty severely, and I can't remember. Well, the third surgery was an elbow. Yeah, that's right. And so
this is the year before you came to us,
right? And so the first of that year, I just wasn't feeling good, and I told my wife, I can't tell you why. I don't feel good. I just don't feel good. And so when we came here, that was the first thing that Dr. Prather suggested we check is heavy metals. And he explained that if you have your blood drawn to test for that, the only result that will show is if you're currently exposed. You have to test it through the hair to know if it's in your organs and has been there for quite some time.
And that's what you had, is the hair analysis.
Right.
Which is a very affordable test.
Yes.
Yes.
Yep.
$110, and that gave you your health back.
Well, yeah, I was going to say, no matter what the cost, almost it was worth finding that out.
Right.
So.
And what results have you noticed since the chelation?
Well, I've only had one orthopedic surgery in the last 2 years.
Which is big for you. Which is a big thing for you.
It's a record, yeah. But it's just on my shoulder that it's been operated on so many times. It's, it was to clean it up and stuff. So other than that, I felt a lot better.
More energy.
Yes.
Wonderful.
Yep.
And I know you are, your family comes in. So your wife is a nurse practitioner.
Yes.
And she was the one that encouraged you to come in. And she's become a patient, and your daughter's become a patient. It's a family thing.
A couple fellas I work with have come in, and one of them was in your, I can't remember the name of it, the weight loss program.
DTS weight loss program.
DTS weight loss, and lost like 40 or 50 pounds. Feels wonderful. So the other thing I do here regularly is the EDS.
EDS and the supplementation.
Right. And so
wonderful.
That's been good. Yeah.
So if someone out there is just not feeling well, like you were saying, something's just not right, what would you say to them to encourage them?
To kind of look outside the traditional box. And like my wife did, I couldn't, she's a nurse practitioner, but I couldn't explain to her why I didn't feel good. I just didn't feel good anywhere. And so, like I say, she listened every Saturday morning. On her way to work out, she'd listen to Dr. Prather's broadcast, and she just thought that was where we needed to go, that it was outside like I say, the box, the traditional medicine, but would just try something new and see if it helps. And so that's how we ended up.
Wonderful.
Yeah.
Well, thank you for sharing your story
You bet.
today. I know
Yeah.
it will help someone that's listening to it.
Yeah, I hope so.
Thank you, Ben.
You're welcome.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.